Audio Jungle.
Welcome back. WHO commends Nigeria's push for stronger, sustainable health financing. Nigeria's efforts to reform health financing are earning international recognition. At a high-level policy dialogue in Abuja, the World Health Organization praised the country's progress while urging leaders to scale up investments to build a more resilient and equitable health system.
In Abuja, all eyes were on the future of healthcare in Africa's most populous nation. At the National Health Financing Dialogue, the World Health Organization's Regional Director for Africa, Professor Mohamed Yakub Janabi, commended Nigeria's strides in reshaping health funding. With a population of over 223 million people, he stressed that effective health financing is crucial to save lives and strengthen national productivity. However, the WHO has cautioned that much more remains to be done, urging Nigeria to raise public health spending to at least 20% of total government expenditure, cut down out-of-pocket costs for families, and ensure decisions are rooted in fairness and equity.
Nigeria is showing what is possible. A basic healthcare provision fund, a National Health Insurance Authority Act, an expansion of state-level insurance schemes. These are not just reforms. These are foundations. The creation of equity and investment units and the engagement of parliamentarians I see in front of us here through legislative network for universal health coverage are not just policy innovation. They are political courage in action.
Professor Janabi, while pledging WHO's full partnership with Nigeria in building a health system that is inclusive, equitable, and responsive to the needs of all citizens, also called for sustainable action to guarantee that every Nigerian, regardless of location, has access to affordable healthcare. A move, he said, will help avert future outbreaks and emergencies.
What is needed now is implementation, bold, sustained, and accountable. At WHO, we believe that sustainable financing is the backbone of expenditure. It's a backbone of a resilient health system. This means increasing public health spending. Domestic financing does not mean stopping talking to donors, to stakeholders. As Chinua Achebe once said, the trouble with Nigeria is simply and squarely a failure of leadership. Today in this room, we are witnessing the opposite. Leadership rises to meet the challenge, and health financing becomes a cornerstone of national transformation.
As the nation continues its march towards universal health coverage, the dialogue marks a critical step in pushing health financing reforms from policy to action to build a more sustainable healthcare system in the region. Vincent Okushi, QTV News.
Audio Jungle.